Consider the following cases where the use of PPE would have had a positive impact on the outcome. A research assistant sustained severe burns in a laboratory chemical fire while working with an air-sensitive compound that burst into flames, igniting her clothing. She was not wearing a lab coat, and a month later, she died from her injuries. An absent lab coat was the single most significant factor in the severity of her burns. A laboratory worker experienced cramping, abdominal pain, and bloody stool 4 days after handling a proficiency sample containing E. coli 0157H7 without wearing gloves. Other laboratorians wore gloves while handling the sample, but routinely did not wash their hands after removal. The gel electrophoresis patterns of the E. coli 0157H7 isolates from the infected lab worker matched perfectly the proficiency sample and confirmed the laboratory contamination. Absent gloves and not washing hands after glove removal may have caused the contamination. A graduate student acquired an eye infection from exposure to a Vaccinia virus. A plate of infected cells were removed from the biosafety cabinet and hand-carried to another laboratory room. To examine the cells for fluorescence, the lid from the plate was removed. The student was not wearing eye protection. The student was then asymptomatic for 7 days and diagnosed 11 days after exposure. Wearing eye protection while handling infectious materials outside of containment could have prevented the infection. These incidents do not have to happen. Wearing PPE can prevent laboratory-acquired infections, serious injuries, or even death.